Hi everybody, I'm Dr. John Bright and I'm the Urgent Care Lead for the Virtual Hospital at Home project at Manchester Foundation Trust. So I just wanted to introduce yourself to our services and what we can offer to your patients. But what we do offer, we offer your patient the choice to be able to be cared for in their own environment, i.e. their own home. Now there's different services. We've got the urgent care, which is more of remote monitoring, symptom control and access to inpatient diagnostics, and the community arm. I'm going to speak more on the urgent care, the acute side. We offer a hybrid version of monitoring patients within their own home. We can monitor their vitals, which is the standard pulse, blood pressure, temperature for your infective patients. We can do daily weights for patients who have heart failure, and we have a new project with home IV services. We can monitor saturation for our respiratory patients. And where do we actually come from? Well, we came from the COVID virtual wards, and saturation was our first tool that we had back in the pandemic, and realised we could manage our patients effectively at home and be able to monitor them for early deterioration so they could come back into hospital for appropriate care. So saturation for our respiratory patients, and again for our at-risk patients with viral diseases. As I said, we offer the choice for the patient to be looked after in their own home, and we have a kind of a hybrid suite of looking after those patients. We have the remote monitoring, which is basically using a Whoop type bracelet for their vital signs and maybe a digital scale at home. But also we bring patients up to face and we can repeat blood tests. Say somebody has an outstanding investigation that requires blood tests, we can arrange for that for you. If someone who may be going home on antibiotics that require monitoring of LFTs, we can arrange the face-to-face review with the liver function tests. So we offer remote monitoring, but also we can do the remote monitoring as the patient requires that. If they deteriorate, they're brought back to our services, bypassing the emergency department and coming to see us directly at present on the same day emergency care unit. So when thinking of your patients who wish to have the care in their own home, think of the virtual hospital, the hospital home service for your patients. As stated, we can see quite a lot of different patient groups, but the easiest thing is just call us. We're available from 8 in the morning to 8 in the evening, and we can onboard patients from 8 AM to 7 PM in the evenings, on the weekends as well. We offer the idea that the patient can be monitored in their own home with their vital signs. We can monitor their symptoms, be it headache, be it abdominal pain, be it non-cardiac chest pain. We can monitor their symptoms. But also we offer access to inpatient priority for investigations. Be it a patient comes to hospital and is concerned of an ischemic event, we can arrange a facilitated MR to exclude an ischemic event. If it's positive, then we can refer directly on to the stroke physicians. So think of us for the different patient groups.